The Malaysian Youth Mental Health Index evaluates the mental health of 5,867 young people aged 15 to 30. Farihin Ufiya from NYAWA sees this data collection as a significant step towards addressing mental health issues among youth. However, she emphasizes the need for greater data transparency, which is crucial for more effective mental health interventions.
One of the factors that Malaysia scored the lowest in is physical environment and how it contributes to poor mental health. So this calls for policies to improve urban planning, facilities in university dorms, because we know that this is the main physical environment for young people. But again, it's hard to propose effective policies when the report does not specify whether the low scores are in the urban use or the rural use, because they sample both, but they don't stratify which factors contribute more for a given population. So knowing this, we could advocate for greater policies to improve physical environment, because that is the main thing.
The 2023 Malaysian Youth Mental Health Index survey also revealed that Malaysian youth mental health is moderately satisfactory. Farihin stressed the need for a clearer methodology in data collection to help understand the factors affecting the scores.
So what I'd like to advocate for is more transparent methodology and granular data sharing with other research groups and other CSOs, so that we understand the situation better. Because right now, the reports that are available are quite surface level only at the moment. But some things that stood out for me in terms of the data that was presented is that 6 out of 10 Malaysian youth are depressed. But the index actually classifies Malaysia as moderately satisfactory in youth mental health risk. This calls into question a bit the external validity of the index. So again, it would be helpful to know the methodology. But based on the limited data that was presented, I gather that Malaysian youth are optimistic because the perceived risk is low, despite the glaring fact that 6 out of 10 Malaysian youth are depressed. So this is what stood out to me. But in terms of the factors that we scored very highly in are spirituality and familial support. And this means that this is very much aligned with our Malaysian Asian culture, where family support is very integral. And so I'm curious as to whether the depressed youth do not have access to this support. So again, having more data about whether the affected population are lacking in certain support would be useful, because this is a major coping mechanism. Based on the survey, this is a major coping mechanism and protective factor for our youth, the familial support and the spirituality. And so it would be good to know if the youth that are depressed do not have access to these support mechanisms.